In this video, we are going to discuss about the healthcare system in US and how it is different from the healthcare system in India. Now, let us first look at the Indian healthcare system. As per recent statistics, only 27% of the population in India are covered through health insurance. Although public healthcare is free for everyone through government hospitals and primary healthcare centers, these services are availed mostly by the poor people and those who cannot afford private health insurance. Main reason for this being the quality of healthcare provided at the government hospitals are not up to the standards when compared to the private hospitals. Now, coming to health insurance. The first thing that comes to our mind when we talk about healthcare is insurance policy. In India, we have government-sponsored insurance policies as well as private insurance policies. For example, if anyone in your family or your relative's family is into a government sector job, they and their family members get health insurance coverage either through CGHS, which is Central Government Health Scheme, or through ESI, Employees State Insurance, depending upon whether they are into central government job or a state government job. Now, both CGHS and ESI are considered as government insurance. People who work in the private sector job, health insurance is provided to them by their employer through private insurance companies. Companies like Star Health, HDFC Ergo, Apollo Munich are considered as private insurance. Any individual can purchase health insurance for themselves and their family members from private insurance companies. Although insurance companies are an integral part of our healthcare system, most of the policies will only cover inpatient services, or to be more precise, they will cover only the hospital bills. Doctor outpatient services or doctor office visits are not covered under these policies. However, few insurance companies are starting to offer policies which will cover doctor office visits also, but still in early stages of implementation. While many developed countries like Sweden, Australia, Spain, etc. have universal healthcare, US is the only developed country without universal healthcare. Now, what is universal healthcare? It is a system followed in most of the developed countries where quality medical services are provided to all citizens. The federal government offers it to everyone regardless of their ability to pay for those services. Now, coming to the healthcare system in US. Healthcare in US is delivered to its citizens through a combination of government-funded insurance programs and also through private insurance programs. Almost 90% of the population in US are covered through health insurance. Now let us look at some statistics. Out of the total population of 327 million, around 156 million are covered through employer insurance, which is mostly private insurance. and around 120 million are covered through Medicare and Medicaid services, which are government policies. Armed personnel, people who serve in the army, retirees, those who have retired from the service, and their family members are covered through insurance programs funded by the Department of Defense. Now, 3 ways in which healthcare system in US is different from healthcare system in India. The first one, health insurance policies in US will cover inpatient, outpatient, that means clinic visits, prescription drugs, and medical devices based upon the type of plan the patient has. Now the second one, there is a regulatory body in US healthcare system which takes care of the reimbursement structure, and doctors have to adhere to insurance reimbursement guidelines. And this regulatory body is known as CMS, Centers for Medicare and Medicaid Services. Now the third one is use of information technology in terms of submitting claims electronically and also in reimbursement process. Thank you.